Hi, everybody. I want to briefly give you some updates on the coronavirus situation. First, I would like to applaud our frontline healthcare workers and first responders throughout Massachusetts. They are working day and night to keep our communities healthy and safe. My office will continue to stay in touch with Governor Baker, the Massachusetts Department of Public Health, the CDC, and the NIH to ensure that we are doing everything we can to facilitate our Commonwealth's response. I want to encourage anyone who thinks that they have symptoms to call their doctor and seek advice. Most people who get this new coronavirus will recover and be completely fine with plenty of rest and lots of fluids. But those who are older or who have pre-existing conditions, well, they're at higher risk. Anyone who thinks they have symptoms should also take steps to isolate themselves so they don't get others sick. This is a time for all of us to think a little bit differently about things that we can do to keep ourselves and our families healthy. For example, I've asked my team to think through how they can work remotely, and starting Monday, I've instructed my staff here in Washington, D.C. to begin working from home until further notice. I will still be in Congress and voting when the House of Representatives is in session, and rest assured that my team will be working hard to answer your questions, respond to your emails and letters and scheduling requests, and strongly advocate for our community whenever and wherever they can. My Massachusetts offices will remain open but will be closed to visitors. We're also temporarily extending our sick leave policy in an effort to ensure that anyone who does not feel well stays home. And I've made it clear that if anyone comes into the office who looks or feels unwell, I'm going to send them home. I encourage employers to seriously consider following our lead to help protect vulnerable populations like the elderly and those with weakened immune systems. Again, most people who are healthy and get the coronavirus will experience only a fever, a dry cough, maybe shortness of breath, but for some, this is a very dangerous illness. We all know someone that could be put in serious danger if they get this virus, and we need to take action now. Now, I know this is impossible for all workers, and that is why today Congress is working on a bill to ensure that anyone who is sick and can't show up to work doesn't face financial hardship. Last week, the House and the Senate passed and President Trump signed into law an $8.3 billion package of new funding to address this crisis. Our bill included over $3 billion to develop a coronavirus vaccine and ensure that everyone has access regardless of their ability to pay, and $4 billion for local response, hospital systems, and medical supplies. Our Massachusetts congressional delegation has also sent a letter to Vice President Mike Pence asking for the White House Coronavirus Task Force to approve the Massachusetts Department of Public Health's request for a significant amount of personal protective equipment from the Strategic National Stockpile, and to take any and all necessary steps to immediately expand access to affordable coronavirus diagnostic tests. I also convened a conference call with over a dozen major healthcare providers throughout the 2nd Congressional District to listen to their concerns and to make sure that the federal, state, and local authorities are coordinating and working as a team to get them the information, the tools, and the resources they need to respond to cases in Massachusetts. Lastly, today the House of Representatives passed, on a bipartisan basis, the Families First Coronavirus Response Act, which is focused directly on providing support for America's families and workers. Our bill ensures things like paid sick leave for workers so that they don't spread the virus or so they can be caregivers. Protections for healthcare workers to keep our frontline responders safe, free testing, strengthen unemployment aid for laid off or furloughed workers, and provisions to strengthen assistance for kids who rely on school meals and folks that rely on food banks and home-delivered meals. I hope the Senate will pass this bill as quickly as possible and that President Trump will sign it into law. I know many of you are worried, but this is a time for precaution and prevention of persistence, not panic or certainly not denial. And once we get through this, we will work even harder to ensure that our families and our communities are prepared for any kind of future crisis. I want to thank you very much, and we will talk soon.